But before beginning the session, can you please acknowledge is everything fine at your end? Audio video is fine. Can we start our session? So this topic was already given to you, and you must have seen our lectures. And I hope you have prepared well. And let us discuss. This session is not only for the questions discussion, but also for solving your doubts. Okay, because what we have given you the recorded lectures, but we believe that only giving recorded lectures will not help the students. So we are with you guys. Okay, like we are coming weekly live. So this is again one live session as you have already seen. So this time we are coming on YouTube as well. So the students who are accessing this through the YouTube, those will be also benefited. And the idea is you guys can also participate in the quiz, and also if you have any doubt, you can ask. All right. And not only this is a live session, but after this live session is over, this same video will be available to you guys in the recorded format in the app, eMedicoz app, which is the DAMS app as we know, along with the DAMS Delhi YouTube channel. All right. So all set. Audio video is fine. Can we start our session now? Okay, dear friends, so we are going to start now. Okay, this is the question number one, and the timer started. Let me see who can answer. Read the question carefully, and I will be assessing your answers in the chat, in the live chat. Okay, and let me see. Please mark your answer, write down in the chat. You can use either the eMedicoz app, or you can answer in the chat of this YouTube stream which is going on live right now. Okay, either way I'll be able to see who is answering what. Okay, quickly answer, only 5 seconds. Yes, now the timer is up, time is up. And what's the answer to this question? See, when we look at this question, the first segment of the question says atrophy of the intrinsic muscles of the hand, sensory deficit on the medial side of the forearm. That means we are looking at neural deficit in the patient. But when we look at the second component of the question, it says diminished radial pulse, means vascular compression. So basically, we are looking at overall condition which is neurovascular compression. And among these options, what can be the answer? Among these options, answer will be cervical rib. Why? Before coming to why, let us see what is cervical rib. So as we all know, where are the ribs present? They are present in the thoracic region, right? So if I show you this diagram, we can see that the ribs, as we understand, they are present in the thoracic region. So they articulate with the thoracic vertebra. So thoracic vertebra, they have the facets for the articulation of the ribs. But what about the cervical vertebra? Just like other vertebra, cervical vertebra also have transverse process. But what really happens sometimes C7 transverse process gets enlarged. And when it gets enlarged, it behaves like a rib. Now, what's the big deal? Even if it is enlarged, even if it is behaving like a rib, that's okay. We can call it a cervical rib. The question is why it is causing the neurovascular compression. And the answer is because when this enlargement will be there, when the transfer process is enlarged and behave like a rib, it will be attached to the first rib, either by the bony tissue or by the fibrous tissue. To understand if it gets attached, what will happen? First, let us look at the normal anatomy like this. This is the normal first rib where it is attached, giving attachment to the scalenus anterior and scalenus medius muscle. But between the two muscles where they are attached on the first rib, in between these two muscles, there is a gap. And through the gap, we can see the brachial plexus, that means the nerves are passing through, and the subclavian artery is also passing through. Now, this is the normal anatomy of the first rib. If you put any external compression, it can be maybe because of the tumor, any growth, or maybe because of cervical rib. What it will do, it will be compressing the nerve as well as vessels. I hope you got the understanding now. So we are looking at neurovascular compression. That's why answer was cervical rib. Let's move on to the next question. Compression of cervical rib can cause all except. Yes. What it will do? The timer is running. Okay. Take your time. And after that, you mark your answer. So, what's your answer, dear friends? All right. So, if you see, please pay attention to B, C, and D choice. They are like when we say neurovascular compressions will be there, neurovascular symptoms will be there. Obviously, Raynaud's phenomenon and CAT1 paresthesia will also be there, right? So, basically, B, C, D are the features of the cervical rib because the cervical rib will be compressing the nerve and the vessels. But thinner hypertrophy will not be there. Why thinner hypertrophy should be there? Rather, there will be because the nerves are not working, so there will be atrophy of the increasing muscle of the hand. That's why answer will be A, thinner hypertrophy. Do you appreciate this? Let's move on to the next question and mark your answer in the chat box. The timer started running. First, you identify the given structure and then what will be true among these four options for the marked structure. The hint is we can see the sternum, and this structure is running in the parasternal position. Parallel to sternum, it is going downward. Okay, this structure is? Yes, dear friends. All right. So answer is like first, what is identification? This is internal thoracic artery because internal thoracic artery travels in the parasternal position, parallel to the sternum. It is going downward. It will be keep on going, giving two branches in each space, and these two branches are anterior intercostal arteries. Okay, it is not running posterior, rather it is running anterior to the transverse thoracic muscle. It ends in the sixth intercostal space is the true statement. That's why B is the answer. It divides into superior and inferior. No, it divides into superior epigastric and musculophrenic artery. Okay, instead of inferior epigastric, it will be musculophrenic artery. And yes, what about the next? It is posterior to the six ribs as such. No, it is better to say costal cartilages. So B is the directly clear cut answer. So we'll go with definite answer. B is the single best answer, or you can say the most appropriate answer. So this is what you can say internal thoracic artery. You can see the sternum. All right. Next question, and the timer will start. Read the question carefully. Yes. What is your answer? You can mark in the chat on the YouTube, or if you want, you can mark in our app also, eMedicoz app. So basically, you got a patient with the fever, chills, malaise, etc. And when you are doing the examination, you found a murmur. To evaluate the murmur further, you tried to go for echocardiography. But which echocardiography you are using? You are using transesophageal, means you are putting the probe inside the esophagus and you are looking just anterior to it. Although you can evaluate all the chambers, that's true, but who will be just anterior to the esophagus? Answer is left atrium. Why? Please remember these two chambers of the heart. Left atrium is in front of esophagus, that you need to memorize. Although I will show the diagram and explain also, but you need to memorize this point that in front of esophagus it is present, and the right ventricle is behind sternum. It is behind sternum, like that. Okay, so why this is present in front? So let me explain. What you can see over here, this is the aorta and this is the pulmonary trunk, and you can see both of them, they have been enclosed together in a single tube. You can say kind of this is arterial tube, and you can see over here these are the pulmonary veins. How many? Four. This is superior vena cava, this is inferior vena cava. Overall, we have got a venous tube where six veins are there. So we can say the pericardium comes with an arrangement where we have one arterial tube and one venous tube. Between the two tubes, we have a sinus that's called as transverse sinus, and here we have one sinus called as oblique sinus. But behind the oblique sinus, we can see some bulges there. What is this bulge for? This is a bulge. Yes, can you guess, beta? What is this bulge? Which structure is creating the bulge? Or this is prominence? Which prominence? Yes, answer is esophageal. So this is esophageal prominence. Now, dear friends, if you see in this part, we have cut the anterior part of the pericardium. Also, we have removed the heart from here. You can see only see the roots of the vessels, correct? So if you can see only the roots of the vessels, but if you put the heart back here, अगर हम यहाँ पे हार्ट को वापस इन प्लेस रख दें तो हम क्या देख सकते हैं that these are the pulmonary veins which drain into left atrium that will be in front of it है ना तो बेसिकली ईसोफेगस के फ्रंट में कौन होगा लेफ्ट एट्रियम who will be in front of esophagus left atrium I hope that makes sense so please memorize this point left atrium is in front of esophagus and the right ventricle is behind sternum let's move on to the next question and the timer started initial few questions are with the timer later we do not have the timer and we can simply answer without the restriction of the timer okay now yes if you can identify this all right so dear friends those who have understood very well and good otherwise let me explain what is this vein is the left subclavian vein and what is this vein is left internal jugular vein. Now, from where the subclavian vein is receiving the blood from the upper limb part, right? From this axillary vein will become subclavian vein over here, correct? So basically, we can say subclavian vein is representing what? It is representing your brachial element. Brachium means arm, है ना? ये क्या represent कर रहा है? Brachium को, arm को. And jugular vein is coming from the head neck region, that is the cephalic part. So brachial vein is coming, cephalic vein is coming. Together it becomes what? Brachiocephalic vein. So what is the marking over here is the left brachiocephalic. What is this marking? This is left brachiocephalic, whereas this one will be right brachiocephalic. I hope you understood. Did you understand this? How to identify this, Hannah? Because we can see the subclavian veins are coming from the arm or upper limb region, which is called as brachium, and here we have the jugular vein coming from the cephalic part, and overall we have two brachiocephalic, right and left. If you compare with the brachiocephalic artery, we have only single brachiocephalic artery that is on the right side only. Left side में we do not have. Only on the right side में हमारे पास एक brachiocephalic artery होती है, correct? But brachiocephalic veins are two, okay? And when they merge, they will make superior vena cava. I hope that makes sense. Yes. Now the left brachiocephalic has been marked, and we have been asked, okay, what will be the false? Does it drain into superior vena cava? That is true. It is going to receive left first posterior. That is also true. And superior intercostal also true. But whether it will receive accessory hemizygous? No. It will be draining into azygous vein, not into the left brachiocephalic. So answer will be D. Yes. Very good. Abhinavan Yadav, very good, beta. You have marked the correct answer. And let's move on. I have put this image. It will be also uploaded. All the you see markings are there, which we have already learned the subclavian, the jugular vein, cephalic, and all right. So let's move on and we can see this question. Read this question. Again, the timer started. Yes, what are you going to mark? So indirectly we have been asked that which artery supplies the part of conduction system or majorly the conduction system. Answer is straightforward, right coronary artery. Why? Because when you look at the conduction tissue, we have got SA node, okay, we have got AV node. Where is the SA node? Upper part of the sulcus terminalis, and we have AV node which is in the coast triangle. Then we have bundle of his which divides into bundle branches, and as per Gray's anatomy, except for bundle branches which are the distal part, rest all is supplied by right coronary artery, and the bundle branches are supplied by left coronary artery. So majority part of the conduction tissue is supplied by right coronary artery. Next question. Unequal division of the truncus arteriosus. What will happen? What is the given condition? Now, if you can recall, when we discuss in our class, truncus arteriosus, you put it in a single simple language. Truncus means trunk, arteriosus means arterial. Arterial trunk will divide into two major arteries, aorta, that means ascending aorta, and pulmonary trunk. So when it divides into ascending aorta and pulmonary trunk, normally it should be equal division. But if it becomes unequal, what will happen? If it becomes unequal, then there will be pulmonary stenosis and aorta will override. If pulmonary stenosis is there and aorta is overriding, what will happen next? There will be VSD will be kept and RVA, right ventricular hypertrophy, will develop. That's why it's tetralogy of fellow. Tetralogy of fellow is there. If I explain with the help of this, okay, and here you can see that suppose we have got this the truncus arteriosus, which is divided into two parts by the spiral septum into ascending aorta and pulmonary trunk, correct? So what can happen? Normal circumstances, we have right ventricle and the left ventricle. If I ask you guys to make iota, definitely you will make arch of iota like this, है ना? If I ask you guys to make pulmonary trunk, you will make pulmonary trunk like this. So absolutely speaking, iota is on the right side, pulmonary trunk is on the left side, but they must take the blood from reverse. So how it will happen? The left ventricle will be able to send the blood here, and the right ventricle will be able to send the blood here because the septum is spiral. So we can say spiral septum is normal. What we can say, spiral septum is normal. If it is there, everything is fine. But by chance, if septum is non-spiral, straight, in that case, right ventricle will open here and the left ventricle will open here. What is this? Ulte pulte connection. क्या बोलते हैं इसको? Transposition of great vessels. This is one condition. But by chance, if you see, we have like right ventricle and the left ventricle, and the truncus arteriosus divided in unequal manner, so much so that aorta is very huge and pulmonary trunk is compromised. What will happen? Now we have the right ventricle, left ventricle, and aorta is huge. So you can say aorta is like very huge, kind of very, and pulmonary stenosis is there, so it is like stenosed kind of structure. Where the left ventricle will put the blood into the aorta, even the right ventricle also in the same. Why? Because even if the right ventricle wants to send the blood to the pulmonary circuit, it is not receptive. So anyway, the mixing of the blood is going on, so there is no point making the terminal part of the septum. So VSD is kept, and finally, over a period of time, the right ventricle thickness becomes as equal to left ventricle thickness, and this is called as right ventricular hypertrophy. So these four features taken together is called as tetralogy of Fallot. And by chance, if there is the initial truncus is called as truncus arteriosus. Suppose there is third condition, that is no septum is ever formed. If there is no septum, means truncus arteriosus will persist as persistent truncus arteriosus or patent truncus arteriosus. Did you understand, beta? Yes, very good. These are the congenital heart abnormalities. Very good. And ये जो तीनों हैं, these three they belong to what? Cyanotic heart disease. इन तीनों में एक चीज common होगी. The feature will be cyanosis. Okay. Now, dear friends, let's move on to the next question. And this is the question. Cyanotic infant, first hint. It was delivered and you have diagnosed the vessels are transposed. Okay. We have just now learned when the transposition will take place. But anyway, to keep the like for the survival, we have to keep the ductus arteriosus patent. We have to keep the ductus arteriosus patent. So which drug is contraindicated? The one who can close the ductus arteriosus. So because closure is not required, and for the closure, which drug we use? Indomethacin. So indomethacin we can't give. Okay, indomethacin is a NSAID, right? So this is a prostaglandin inhibitor, but we can't use it. We have to give the stimulant, prostaglandins. Okay, so indomethacin, which is the prostaglandin inhibitor, acetylcholine, histamine, and catecholamine. These are the drugs used for closure of the ductus arteriosus. But in this condition, closure is not required. Okay, patency is required. That's why these drugs will not be used. Next question, the patient coming to the emergency after stab injury, and where is the position of the weapon? It passed in just parasternal position. Which of the following chamber the weapon must have entered? So we know just behind sternum. I have asked you to memorize two chambers of the heart. Can you recall? Just anterior to esophagus was left atrium, but just behind the sternum, which chamber was there? That's the answer. Okay, now let me just add a little detail here. If there's a injury given just right to the sternum, in the parasternal, it can be left or right. If it is given just right, we can make a guess also, right ventricle. But the point here is, even if it is just left to the sternum, then even then the answer will be right ventricle, because just behind the sternum we have right ventricle present like this. Now you can appreciate. Let me zoom in. Can you see the outline of the sternum? And just parasternal on the this aspect we have the right ventricle. On this side also right ventricle. Too much left towards the apex will become left ventricle. Now identify this structure. Identify this structure, and based on this structure we have a question. Which of the following is true for this particular structure? Is it a motor peripheral nerve? Choice A. Is it motor peripheral nerve? Second, it is present just in front of scalenus medius. Both sided nerve pass through IVC opening, or it passes anterior to the lung hilum. What was the mark structure? The mark structure was phrenic nerve. Okay. Now, with respect to phrenic nerve, which is true? Answer quickly. Answer. Yes, everyone. Answer will be D. It passes anterior to the lung hilum. You can see that's the lung hilum. This nerve is coming in front. That will be phrenic, and the one which is coming behind, that will be vagus. So here you can see this is not motor. It is actually mixed because it is also carrying the sensation, and it is not medius but anterior, and not both side, only the right side will pass from the IVC opening. Answer will be D. So let's look at this labeling. You can see all the important labeling. We can see vagus is behind and phrenic is in front. Other structure also you can, like, just look at the way internal thoracic artery, you can see this will be in the parasternal position behind the costal cartilages and all. So important structure you must understand and you must memorize. Let's move on. Next question. So this is the embryological picture where few vessels are getting disappeared. And question is, for the abnormal subclavian artery, what should happen? For the abnormal, not for the normal. It's a little difficult area, but we have discussed in the class. And directly for the undergraduate university exam, this may not be asked because very few universities will ask these type of questions, okay, from the undergraduates. But this area is important for NEET or INI exam, okay, especially for the INI exam, it is important. And what you can see that initially everything is symmetrical and later there will be changes according to the adult anatomy. There is the rule of embryology. In the very initial period, everything will be given in a symmetrical manner. Whatever is required, that will be kept and that will be making the final structure, and whatever is not required will be simply disappearing. For example, here, this is going to make the arch of aorta, and this is going to make the right subclavian artery. But right subclavian artery is far off. Look at the left subclavian artery. Left subclavian artery is directly attached to the arch of aorta. Let me remove my video for a while. Now, dear friends, can you see that left subclavian artery is directly attached to the arch of aorta, but the right subclavian artery is far off. So for the connection, either it needs choice, I mean segment A for the connection, or segment B is required for the connection, because somehow it has to be connected with the arch of aorta. Do you appreciate this much part? Now, normal circumstances, A will be kept and B disappear. It is normal. It is normal. But what is abnormal? For the abnormal, A will disappear and B will be kept. And if by chance both are kept, in that case it is double aortic arch, because left side the whole thing is remaining, it is called as arch of aorta. If right side also it maintains, then it will be called as double aortic arch. And very good, beta Abhinaman Yadav, very good, you have given the correct answer, because it will lead to oblique. For the abnormal subclavian artery, A should disappear and B should persist. That's why C is the answer over here. Now this question over here is this. The patient is admitted to hospital after suffering cerebral infarction, and even though patient was on the dietary restriction, but still he had one episode of vomiting while lying on the back. Subsequently, there is pneumonia. Yes. See, whenever we are discussing any sort of aspiration or foreign body, will it go preferably to the right side or to the left side? It will preferably go to the right side. So suppose, just for example sake, if 1 liter is the fluid going inside, just for example sake, almost 60-70% or maybe the 80% will go to the right side only, because the bronchus is wider, shorter and more in line. The remaining will be going to the left side, and that too it will be divided into various bronchopulmonary segments. So basically left cannot be the most dependent, so these are ruled out. But what is the real answer here? So for that part, we need to remember something, which is like, if there is supine position aspiration, answer will be segment number 6 better than 2. What is segment number 6? It has got two names. It is called as apical basal, or in some books superior basal. What about segment number 2? It is the posterior segment of upper lobe, like that. But what about erect position? For the erect position, segment number 10, that's the answer. And what's the name for the segment number 10? Is the posterior basal. And wherever we have written the term basal, means we can write lower lobe also. So instead of saying posterior basal, we can say posterior of lower lobe. So here we have Either this should be the answer or this should be the answer, but among these, B is given, which is nothing but segment number 2. I hope that makes sense. Yes, dear friends, did you understand up to this much part? Everything okay? This information which I have provided in a very concise and crisp manner is very, very important clinically. You will be getting the patients, yes, along with that, you will be getting the questions. And then you have to see whether it is a supine position, whether it is an erect position. Accordingly, you have to mark. Now, this question, what structure will pass through the central tendon of the diaphragm? So, central tendon of the diaphragm is for what? Who will pass from that region? Mark, the timer is going on. Yes, dear friends, can you tell? Central tendon is where we have IVC present. That's a hint. That means we are looking at a structure which is going to pass through the IVC opening. What's that? Yes, quickly answer. Right. Right phrenic nerve. Very good. You have already answered. So right phrenic nerve is the answer. Why not left? Because these nerves anyway they have to pass through the diaphragm or maybe they have to come down only. But the right phrenic nerve when it wants to go down, it sees one opening is already there. It passes through the opening. But left side we do not have any opening. So it pierces the diaphragm, comes below and supplies. Okay. Very good. Correct answer. Now you can see this is the central tendon and through the central tendon we have IVC. Naturally it will pass along with that right phrenic. Esophagus is here. This is the esophagus, but it is present in the muscle part, so it will be during the inspiration, the esophagus has to constrict. But where is the aorta? This opening is where we have the aorta present. In fact, from the aortic opening, we have aorta structure coming out. Aorta. What is aorta? Aegis. From A for aorta, T for thoracic duct, and A for aegis vein. Okay. Aegis vein mostly will come from here. Sometime it may come also from the crura. Now, which of the following does not drain into aegis vein? Yes. I'm waiting for your response. Either the timer will stop or you will answer, then I will start explaining. So basically, this is dealing with the aegis vein, and I'll tell you one very simple way how to memorize. Okay. So first of all, there is a term called as superior intercostal, both on the left side and on the right side. This is the second to fourth vein, which is called as superior intercostal vein. Okay. And the left superior intercostal vein will be the answer here because it drains into what? It drains into left brachiocephalic vein, not into aegis vein. And how to memorize this? Let me show you this diagram. So please remember on the right side, first vein is fixed. That goes to right brachiocephalic. And after that, whatever number 2 to 12, they can ask you, answer will be aegis vein. That's fixed. So first vein brachiocephalic. After that, whatever vein on the right side, it will be draining into aegis. Left side, we have three areas. This is the area number 1, this is the area number 2, and this is the area number 3. And these areas means for our understanding, these are veins. These are actually veins. But for our understanding, I'm saying area. So we can say three areas are there where 12 veins will be draining. So how much? Like 1 to 4, 5 to 8, and remaining like that. So 1 will come directly, and second, third, and fourth will come in the form of left superior intercostal. But anyway, 1 to 4 will drain into left brachiocephalic, and 5 to 8 will drain into accessory hemiaegis, and 9 to 12 will drain into hemiaegis vein. So far, so good. So this is how we can remember which particular number vein is going to drain where. And let me tell you something over here that, dear friends, let me just share with you. This is my YouTube channel where I have put these type of videos only. Okay, like how to memorize. Small topics are there where I have given either the tricks or the mnemonics. Okay, so just visit this YouTube channel. Simply Dr. Sandeep underscore Madaan or Dr. Sandeep Madaan, and the channel will open, and all are with the tricks like artery. For the artery, how to memorize, we have used the tricks, mnemonics, and these type of structures also. There I have given how to memorize. Okay, even the pharyngeal arches are also there. So I will suggest just see the topic once. Anyway, now let us move on, and we have seen question number 14, and now we will be looking at question number 15. All open into coronary sinus except one. So this is very, very important. Why? Because coronary sinus is the one which is going to receive the venous drainage of the heart. Venous drainage of the heart means cardiac vein. Look at all four are cardiac. Now that's interesting. Why? One of them is cardiac, but not draining into coronary sinus. Very, very important and straightforward answer is anterior cardiac vein. Do you understand? Anterior cardiac vein. Even though the name is anterior, even though the name is anterior, but it will be not draining into coronary sinus, rather it will be opening into the chambers of the heart and mostly into right atrium. Now this question, bleeding comes from the vein that is accompanied by posterior interventricular artery, and if you remember during the classes what we were calling this artery as PIVA. Do you remember PIVA, posterior interventricular artery? So who will be accompanying this? That will be middle cardiac vein. If you remember, when we write these veins, that time with against these major veins, great cardiac, middle cardiac, and the small cardiac. Okay, video is not paused, beta. Video is going all right. Dr. King SSR, I think everything is fine. Can you please check? है ना? Video is fine. All right. So, dear friends, when we were writing this, okay, at that time I told you that cardiac veins like great cardiac, middle cardiac, small cardiac, against them I write in the bracket artery. And I tell you that these are the major veins, so we need to remember which artery territory they are going to drain. So, middle cardiac vein, we write always in bracket PIVA. I hope now you are able to correlate. Yes, video is working fine now for you guys. Yes, very good. Thanks for the confirmation, Dr. King SSR. Anyway, you have got very good name, Dr. King. अच्छी बात है, किंग बनो आगे मेडिकल वर्ल्ड के, अच्छे से प्रैक्टिस करो पेशेंट्स के लिए. यू सी हाई-फाई टेक्निक्स बट एट द अफोर्डेबल प्राइसेस यूज करो. मेन बात है गुड फिजिशियन बनना. देखो डॉक्टर, everyone will become, who has entered the MBBS program, they will become doctor, but there is always a difference between doctor and a good doctor. So I always tell my students, you should pursue this good doctor thing, not only doctor. Okay, why? Because whatever, whichever village or whichever town you are coming from, जहाँ से भी आप आए हैं, उस टाउन में, उस विलेज में, उस एरिया में, उस सिटी में, वहाँ पे कोई ना कोई एक बड़ा ही फेमस डॉक्टर होगा जिसके नाम से सभी लोग आते हैं, है ना? दैट इस डॉक्टर एक्स के पास हमें जाना है, इस डॉक्टर वाई के पास हमें जाना है, राइट? उन डॉक्टर एक्स और वाई के चैम्बर में, उनके क्लिनिक पे बहुत लंबी लंबी लाइंस लगती हैं, सुबह से लोग आगे वेट करते हैं. या अगर वो मल्टी लाइक किसी बिग हॉस्पिटल में काम कर रहे हैं, अपोलो में या एस्कॉर्ट में, किसी में भी, तो वहाँ पे आप देखोगे उन्हीं के पास सबसे ज़्यादा लाइन होती है. बाकी उनके पैरेलल वाले शायद उतना नहीं कर पा रहे होते. डिग्री सेम है, क्वालिफिकेशन सेम है, नॉलेज सेम है, फिर भी अंतर है स्किल्स का, शायद एटीट्यूड का, और भी बहुत सारे फैक्टर्स होते हैं. So overall, you have to develop that personality. I hope the message is clear, right, dear friends? Let's move on with the quiz. And if you agree to this, please write in the chat box कि सही बात है ना. हमें एम क्या करना है? बेस्ट करना है, अपना अपना बेस्ट देना है, राइट? अच्छा, अब बताइए दिस क्वेश्चन. ऑल आर फॉल्स अबाउट द मीडियासिनम. द हार्ट इज प्रेजेंट इन द सुपीरियर मीडियासिनम. नो, हार्ट इज इन द inferior mediastinum. Heart is present in the anterior mediastinum. No, the heart is present in the middle mediastinum. So thymus ruminant may present in the middle. No, thymus will be either in the superior or anterior. But what about the posterior boundary of the posterior mediastinum? T1 to 1, T1 to 4 will be present behind the superior mediastinum, right? T5 and below, that will be for the posterior mediastinum. So far, so good. So answer is D. Now this question, all are true. No, only one statement for the which is true for the suprapleural membrane. So basically, from where to where we have got this. Yes, what's your answer? Suprapleural membrane is also called as Simpson's fascia. Okay, it is also called as Simpson's fascia. So, like when you look at this way, we have the C7 vertebra, and this is what transverse process. Okay, and here we have got this lung is there surrounded by the pleura, है ना? ऐसे, like that. And here we have the first rib. Because this is the first rib, some part of the lung and the pleura are above, so that is called as the cervical part. But between the C7 transfer process and the first rib, we have this cover. This is a membrane even above the pleura. Because it is above the pleura, it is called as suprapleural membrane. And the which fascia? Simpson's fascia. Now, dear friends, what is the attachment? C7 transfer process up to first rib. So answer will be B. But dear friends, can you tell me, it contains remnant of one muscle. Which muscle? It contains remnant of scalenus minimus. So now how many scalenus muscle do you know? Total 4. Scalenus anterior, medius and posterior. These were already in your mind. But along with that, we have scalenus minimus also. This is the remnant. So this is the fourth scalene. So what can we remember? That all the scalene muscles, what we can remember, all the scalene muscles, okay, let me write over here, all scalene muscles will be attached to the first rib only, except scalenus posterior, which is attached to second rib. Please remember this point. Next question. Arterial supply to anterior two-thirds of interventricular septum. Yes, dear friends, what is your answer? So this is very, very important that we have two interventricular artery, anterior and posterior. Right coronary artery gives posterior interventricular artery, PIVA, and the left coronary artery will give IVA. And how will they distribute? PIVA will take care of posterior one-third. IVA will take care of anterior two-thirds of interventricular septum. So that's why answer will be B, left coronary artery. So far so good? Next, if the circumflex artery gives off PIVA, then the arterial supply is called as which dominance? Yes, very good question. And I hope you will be marking this correct. PIVA or posterior interventricular artery determines dominance. Normal circumstances, it comes from right coronary. So most of the time we have right dominance. Sometimes as a variation, it might come from circumflex artery because it is the left circumflex artery. Then it will be left dominance B. Very good. Very good. Good to see that you have marked the correct answer. Next question. Occlusion of LAD. Left anterior descending. It will lead to infarction of which area? Can you recall what were the areas? Yes, left anterior descending will be descending anteriorly, and the anterior aspect of the anterior surface is majorly formed by left ventricle. So anteriorly on the left ventricle, that's why answer will be anterior wall of left ventricle. If I would have asked the left, you can say left surface, there we have left marginal artery coming from left circumflex. But if they ask inferior surface of the heart, that is the diaphragmatic surface. That is the diaphragmatic surface. Okay. Next question. Which of the following is situated in the upper part of crista terminalis? Yes. Where is the crista terminalis? It is a crest. Crista means crest. Terminalis means the terminal. So we have the rough part of the atrium anteriorly. Behind we have the like smooth part of the atrium. So at the rough part and the smooth part we have a transition zone. That's where we have the terminal crest or cresta terminalis present. Correct? And who is present in the upper part of it? We have already discussed. Remember when I was describing the conduction tissue, I told SA node is present there. So D is the answer. And where is the AV node present? Can you tell which triangle? Where we have the AV node? AV node will be present in Koch's triangle. And both of them, in fact, most of the conduction tissue is supplied by right coronary artery. Next question is this: aortic hiatus. I hope you remember aortic hiatus is having the ATA structures. ATA. A for aorta, T for thoracic duct, and A for azygous vein mostly. Because sometimes it might not come from here, it might pierce the right crus, but mostly it will come from here only. So it will be containing these three. Azygous vein and thoracic duct is among these given option, but otherwise it contains these three ATA structures. So C will be the answer. Next question, dear friends, we have got this. Which segment are present in the upper part? So if I just quickly revise, on the right side and on the left side, to remember the segment name, we use the mnemonic A palm, A palm. In this side also same thing, A palm, like that. But right side we have, this is upper lobe, this is middle lobe, and these all are lower lobe. Left side, this is upper lobe, and this is all lower lobe, because left side we do not have the middle lobe, that's why. Now what is the name? Like A will be apical, first of all, we start with the apex, so apical. P, obviously we can easily think is posterior, and then anterior. L, lateral, M, medial. Now dear friends, again A palm, yes, but this A palm belongs to which lobe? Lower lobe. For the lower lobe we have which word? Basal. So the same things will be repeated, but we will keep on adding basal. So A for apical, as we understand, but what we will add? Basal. It becomes apical basal. P for posterior basal. A for anterior basal. L for lateral basal. Let me remove my video for a second, Hannah, for a moment, and this will be medial basal. I hope you understand this much part over here. If you see the left sided, it will be same, apical, posterior, anterior, but lateral and medial will not be there. Why not? Because lateral and medial, they belong to middle lobe, and on the left side we do not have middle lobe. Left side we have lingula, which is a counterpart of the middle lobe. So here we will write superior lingular and inferior lingular. Do you understand? Superior lingular and inferior lingular. Rest all are same, apical, posterior, anterior, etc., etc. Rest everything is same. Do you understand? And when you talk about, when you remember this sequence, A palm, you not only remember the name, but also you can remember the number. How? Whatever is the number in position, that becomes their real number position. Like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Only one exception is there. What is that? This medial basal and posterior basal, they have been swapped just to make them fit in the mnemonic A palm, A palm. तो पहले हमने mnemonic बना लिया, हमें याद करना आसान हो गया. We remember the names, we remember the sequence, we also remember the number. But एक catch है, posterior basal is not number 7, rather it is number 10, and medial basal is not number 10, it is number 7. That's it. If you can recall this much, then you can remember all the bronchopulmonary segments of the left side, on the right side, and it will become very easy for you. On the left side, this medial basal, that is segment number 7, is frequently absent. Even though it is frequently absent, but we can't say, we will not change the number of other segments. We will simply say posterior basal is still segment number 10, but we will simply say segment number 7 is absent. So frequently it can be absent also. So upper lobe on the right lung. So it is very easy for us now. Apical, posterior, and anterior. So apical, posterior, and anterior. B will be the answer. And very good to know that already you have marked the correct answer. So till now, I believe you have given all the correct answer. And Dr. King, you marked this question. You have not marked the answer. Okay, please attempt all the questions. See, your answer might be wrong, might be right. It doesn't really matter because this is a quiz. This is a learning session only, है ना? We are learning with the help of the quiz. So you are testing this. After that, I am explaining. So you will learn also this, isn't it? So just try once, okay? Now the last question of our session. What is this? And one information before I come to the explanation. Information is these are weekly live sessions which we are conducting on the eMedicoz app, and we will also come on the DAMS-eMedicoz YouTube channel. So you can attend on either of the platform DAMS-eMedicoz app or DAMS-eMedicoz YouTube channel. Okay? And also these sessions are not only for quizzing. It will be done. Along with that, you can ask your doubts also. And from like how to prepare, you just watch our recorded lectures which we have provided you on the eMedicoz app. ठीक है, आप recorded lecture देख के आओ, वहाँ पे आपको quizzing का schedule भी मिलेगा. And in between, if you have any doubt, and I'll be taking small lectures also on the YouTube. Okay, तो आपको जिस भी टॉपिक में डाउट होता है आप मुझे बताओ, मैं उसको और कंसाइज और भी इजी करके डिफरेंट डायग्राम्स से आपको फिर से एक्सप्लेन कर दूंगा. ठीक है, ऑल राइट. Just keep on studying and keep on preparing well. All right. This question now come to the explanation. It is eventration. Let me explain. We have two domes of the diaphragm. These domes of the diaphragm, they will contract in the normal phase of inspiration because diaphragm is the major muscle of respiration. Correct? Now this is normal. But suppose one side phrenic nerve is not working. Phrenic nerve is the nerve supply for the diaphragm. If one side it is not working, the dome become flabby. Normal dome will go downward. This flabby membranous type of dome now, it won't even move downward, it won't even remain in the neutral position. Rather, it will move upward. Why? Because during the inspiration, thoracic cavity will have negative intrathoracic pressure, which will suck in. So this will go upward, this will go downward. It is called as paradoxical. So when the expiration, intrathoracic pressure becomes positive, it comes down, but because of expiration, it is coming up. So it is always paradoxical respiration. There are two possibilities. Either one, the nerve is gone and the muscle has become flabby, or second, muscle never developed in the first place. And this is what the question is. This is what the question is, that eventration, we use the term eventration when there is no muscle. If the muscle fail to develop, answer will be B, but let me explain in brief how the diaphragm will develop. So let me quickly revise this part. Answer is B. See, in the normally, when we are looking at the development of the diaphragm, we have in the very initial period, we have septum transversum, we have dorsal mesentery of esophagus. But at this stage, we have pleuroperitoneal canal, means it is yet to be made. It has not been made till now. So let me explain in this way. Suppose where you are sitting, you want to divide the room into two parts. How you can divide? You can divide the room by putting a wall, but the making a wall will require the bricks, will require the cement. It requires time, effort. ऐसा थोड़ी है कि immediately you just think and wall is made, है ना? Exactly in a similar manner, we are going to make the diaphragm here. But diaphragm is majorly muscles. So muscles will migrate, they will move here, they will settle. It will take time. But if you want to divide the room, the bricks and those things will take time. What you can do as an interim management, immediately you want to divide. You want to divide, you can put a curtain, you can put a cardboard wall. So, these are kind of interim managements. Immediately you can divide, but these are not final solution. Finally, bricks wall has to be made, correct? In the diaphragm, we have to make the diaphragm which is made up of muscle. But as I said, it will take time. So as an interim management, initially the membrane will come over here. It will seal the defect. And after that, the muscle starts coming from the body wall. And eventually they become the large body wall. Question is, which part of the body wall it is coming from? So here we can simply remember that these are the parts of the diaphragm. They are coming from this source. And look at the peripheral part. Most of the peripheral part, it is coming from body wall. It's a muscular part. Small peripheral part is membranous. Okay. Question here is that which part body wall it will be coming from? Have you ever thought what's the root value of the phrenic nerve, the nerve supply of the diaphragm? The nerve supply of the diaphragm is the phrenic, but the root value is C345. How will we remember? Remember like this. C345 keeps diaphragm alive. So 3345. This is the position of cervical. And what's the position of the diaphragm? Here, between the thorax and the abdomen, we have the diaphragm lower down. Have you ever thought why the cervical nerves of the neck region, they are going down to supply the diaphragm? Because the myotomes, muscle, it migrated from the cervical region. When the muscle migrates and goes down, it takes the nerve supply also along with it. So muscles will migrate, nerve supply will migrate, and they muscle will settle, and nerve supply will take care of the muscle there. Is that all okay? Have you understood? Please confirm, dear friends. In today's session, could you understand everything? Yes. So now you can, if you want, you can share the score, or at least even if you don't want to share the score, no problem. Just keep a track of your growth, that how you are eventually growing. Is that all okay? And if you have any doubt, please do connected with me on my Insta, and this is my YouTube channel also, where I have already put certain videos. Okay. And I'll, as I said, I'll be taking small topics here. So please get connected so that you get the notification in time that I'm going to take this topic, or I have uploaded this video. All right. So, dear friends, thank you so much. God bless.